Hi friends, this is Dr. Muhammad Iftikhar Aslam from Pakistan presenting my lecture on a very deadly disease of poultry birds called as Marek's disease. Marek's disease is a highly contagious viral disease of poultry characterized by T cell lymphomas and peripheral nerve enlargement. It is characteristically a disease of young birds between the age 8 to 17 weeks, but older birds can also be affected. It is named after the Joseph Marek, a Hungarian veterinarian who described it in 1907. It causes the production of tumors in the lymph nodes, skeletal muscles, and visceral organs of the affected birds. The organs which are commonly affected during this disease include ovary, spleen, liver, kidneys, lungs, and heart. The tumors caused by this disease can cause organ failure and ultimately can kill the bird. Mainly, it is found in chickens, but quail can be naturally infected, and turkeys can be infected experimentally. However, severe clinical outbreaks of Marek's disease in commercial turkey flocks with mortality from tumors reaching 40 to 80% between 12 and 25 weeks of age were reported in France and Germany. Marek's disease virus is a member of the genus Mardivirus within the subfamily Alpha herpes viridae. The virus is concentrated in the feather follicles and shed in dander, where it can survive for several months. Currently, four phases of infection with the Marek's disease in vivo are recognized. The first phase is early cytolytic infection, which is productive or restrictive. The second phase is latent infection. The third phase is associated with the cytolytic infection with the permanent immunosuppression. And the last one is proliferative phase involving non-productively infected lymphoid cells that may or may not progress to the point of lymphoma formation. Productive infection may occur transiently in B lymphocytes within a few days after infection with the virulent Marek's disease virus strains and is characterized by antigen production, which leads to the cell death. Because if any virions are present, this has also been termed as restrictive productive infection. Productive infection also occurs in feather follicle epithelium in which enveloped virions are produced. The clinical signs of this disease include labored breathing, lameness, transient paralysis, incoordination, blindness, paleness, greenish diarrhea, early mortality syndrome, cytolytic infection, atherosclerosis, persistent neurologic disease. Typically, the affected birds show only depression before death, but a transient paralysis syndrome has been associated with the Marek's disease. Chickens become ataxic for periods of several days and then recover. This syndrome is rare in immunized birds. Death is usually the result of paralysis, rendering the birds unable to reach food and water. For the diagnosis of Marek's disease, it is critical to diagnose the tumors and not the infection because Marek's disease is considered to be present within the commercial poultry flocks worldwide. Usually, the diagnosis is based on enlarged nerves and lymphoid tumors in various viscera. Here you can see the sciatic nerve of a bird infected with the Marek's disease. It is very enlarged because of this virus. Marek's disease is highly contagious and readily transmitted among the chickens. The virus matures into a fully infective, enveloped form in the epithelium of feather follicle, from which it is released into the environment. It may be present in the poultry house litter or dust where it can survive for 6 weeks. Dust or dander from infected chickens is particularly effective in transmission. Once the virus is introduced into a chicken flock, regardless of the vaccination status, infection spreads quickly from bird to bird. Infected chickens continue to be carriers for long periods and act as a source of infection virus. Shedding of infection virus can be reduced but not prevented by prior vaccination. Unlike virulent strains of Marek's disease virus, which are highly contagious, turkey herpes virus is not readily transmissible among the chickens, although it is easily transmitted among the turkeys. The transmission of this virus is horizontal. It cannot be transmitted vertically. As the Marek's disease is a viral disease, there is no specific treatment. Rather, it can be prevented by vaccination within 3 days of the age of the birds. Vaccination can only prevent the formation of tumors, but it doesn't prevent the virus. Other ways to prevent the virus include the proper cleaning of the house, controlling the migratory birds, and ensuring the biosecurity during the farm to farm visits. Marek's disease can be controlled by ensuring the quarantine measures when any birds is seen affected by any of the clinical signs. If that affected birds doesn't die, it can be carrier of this virus and can infect the other birds present in the same farm. Well, that's the end of our today's lecture. Hope you would have learned something from this lecture. Thank you so much.